Welcome to the TOEFL listening section. In this part, you will hear one or more conversations in an academic or campus context, such as a discussion between a student and a professor, or between two students. You may take notes while listening. Listen to part of a conversation. You will hear it only once, so listen carefully. After the conversation, you will answer questions about what you heard. Some questions will ask you about main ideas and details. Others will ask about implied meaning, speaker attitude, or how ideas relate to one another. Use both what is stated and what is implied to answer.
Good afternoon, Dr. Morales. Thank you for seeing me during office hours. I wanted to go over prevention strategies for my research proposal on zoonotic disease prevention.
Good afternoon, James. Tell me which transmission pathways you are focusing on and what kind of animal populations you plan to study.
My proposal concentrates on livestock to human transmission on peri-urban farms. I am particularly concerned about direct contact, aerosolized fluids during birthing, and indirect transmission through contaminated fomites and vectors.
That makes sense. Peri-urban interfaces are high risk. For aerosolized fluids during birthing, you should consider pathogens like Coxiella burnetii, which cause large Q fever outbreaks in goat farms. It spreads through birthing products and can be airborne over short distances.
Yes, I read about that case. In terms of prevention, what combination of measures is most effective? I know culling was used in some outbreaks, but that has ethical and economic consequences.
Prevention requires a layered approach. For farms, we recommend strict biosecurity, vaccination of animals when effective vaccines exist, targeted culling only as a last resort, and public health measures like personal protective equipment for workers. Ring vaccination around detected foci is often more acceptable than mass culling, because it reduces transmission while minimizing social disruption.
Could you explain ring vaccination in this context, and why it works better sometimes than blanket vaccination of all herds?
Ring vaccination targets animals in a defined zone around confirmed cases. It is resource efficient, and focuses immunity where the risk of spread is highest. Blanket vaccination can be useful for diseases with high prevalence or when vaccines are cheap and safe. But when vaccines are limited or when there are concerns about trade restrictions, ring vaccination can be a practical compromise.
I see. For biosecurity at the farm level, what specific practices should I measure for my project?
Measure controlled access to animal housing, use of disinfection mats and footbaths at entry, separate housing for new or sick animals, proper carcass disposal or composting, rodent control, and protocols for equipment cleaning. Also include worker hygiene practices like hand washing and the use of gloves, and N95 masks when handling high-risk materials.
Regarding rodent control, you mentioned earlier that leptospirosis can transmit from rodents to humans. What integrated measures work against that risk?
Integrated rodent management combines environmental modification, such as reducing food and shelter sources, with trapping and targeted rodenticide use. It is important to protect water sources from contamination, and to vaccinate livestock where vaccines exist. Community engagement is also key because rodents do not respect property boundaries.
That leads me to surveillance. I want to include early detection methods in my study. What surveillance strategies are best for detecting spillover early?
Combine active surveillance in livestock and sentinel animals with passive reporting from clinicians and farmers. Serosurveys can reveal past exposure in animals. Environmental sampling, like testing manure or birthing areas, can detect pathogens shared into the environment. Importantly, integrate human and veterinary data under a One Health framework, so signals in animals can trigger human public health action.
Could you give a concrete example of how One Health surveillance altered the response to an outbreak?
In the Q fever situation, integration of veterinary testing of goat herds with reports of human pneumonia cases helped authorities identify contaminated farms. That led to targeted vaccination campaigns of goats, temporary restrictions during kidding season, and communication to healthcare providers about testing people with relevant exposure histories.
I plan to propose sentinel surveillance using backyard poultry as indicators for avian influenza. Is sentinel surveillance effective for viruses like H5N1?
Sentinel poultry can be useful if they are monitored regularly with rapid diagnostics. For highly pathogenic avian influenza, combining sentinel flocks with passive reporting from commercial operations increases sensitivity. But remember that wild birds and live bird markets are also important reservoirs and need monitoring.
What about vector control for diseases transmitted by ticks or mosquitoes at the farm scale?
Integrated vector management includes habitat modification to reduce breeding sites, use of insecticides or acaricides in a targeted fashion, treatment of animals with repellents, and landscape management to reduce contact between wildlife reservoirs and domestic animals. Personal protection of workers is also necessary.
How should I address antimicrobial use and resistance in my prevention plan? It is related because misuse could make zoonotic bacteria harder to treat.
Exactly. Incorporate antimicrobial stewardship guidelines into farm protocols. Promote diagnostics to avoid empirical overuse. Restrict critically important antimicrobials for human medicine. And encourage alternatives like vaccination and improved husbandry to reduce disease incidence.
For the human side of prevention, do you recommend routine human vaccinations in high-risk communities or just occupational recommendations?
Where human vaccines exist and are effective, vaccinating high-risk occupational groups is advisable. Rabies pre-exposure vaccination for veterinarians and animal handlers is a classic example. For other pathogens, post-exposure prophylaxis and education about early care are important.
Finally, I want to include risk communication and community engagement. Any specific practices that make communication more effective?
Be transparent about risks and interventions. Involve community leaders in planning, tailor messages to local practices, and explain trade-offs like why a temporary movement restriction is needed. Practical demonstrations of hygiene and biosecurity often work better than lectures.
This is very helpful. For my proposal, I will outline layered prevention measures, surveillance plans, and community engagement strategies. Is there anything else I should emphasize?
Emphasize measurable outcomes, such as reduction in seroprevalence, fewer human cases, improved compliance with footbath use, and timely reporting metrics. Also include cost-benefit considerations, because prevention programs must be sustainable.
Thank you, Dr. Morales. I will revise my proposal with these specifics and include the case studies we discussed.
Good. Send me the draft, and we will review the surveillance indicators and the ethical considerations for interventions like culling versus vaccination.
Listen again to part of the conversation, then answer the question.
If we do serosurveys in livestock and sentinel surveillance in wildlife, we can detect spillover earlier and target interventions before large human outbreaks occur.
This concludes the conversation portion. For more TOEFL practice tests and study materials, visit Spinta.org.